The disruptions of the pandemic, social media, gun violence, and racial trauma have had significant impact on the mental health of kids and teens.
Because of the increase in teen anxiety, depression, and suicidal behaviors, mental health among this age group is now a public health emergency. So the question is, what's next? Well, more than half of the nation's public schools offer some form of mental health help. But now programs are expanding for your kids, mostly in cities and suburbs. Senior health correspondent Monica Robbins shows us the changes happening at Bedford City Schools.
Like many districts last year, Bedford schools saw a jump in violence. Police responded for fights and assaults on staff.
Honestly, I want to help.
Randal Rosario witnessed more stress and anxiety in school halls after a year of remote learning. He's hoping to help make things better.
If we were, somehow able to break that and make them see each other in a good light of way, that this could be a better school and a better community overall.
Randal is a sophomore on the football team. He and junior cheerleader Kiara Taylor are among 73 student ambassadors who make themselves available to listen or link students to help.
A couple of people always come for me to help or to talk to, so I just talk to them, tell them to calm down. If they need a breath, I'll step out the classroom with them so they can talk, they can breathe, they go to the bathroom, let their emotions out, and then get back to learning.
It's Kiara's second year as an ambassador, and no, she's not a tattletale.
The reason I'm telling is because it's to benefit and help you in this situation.
Bedford expanded mental health services this year. Faith Gordon supervises social workers, therapists, and a new group of social emotional learning interventionists who work in the classroom helping both students and teachers.
They can remind them, take your deep breath. What do you need to do? Do you need to take a walk for a few minutes? To make sure that we're not wasting a whole lot of education time, but that they are being able to get regulated and get their brains back in that mode of learning.
The help goes beyond coping skills. Social workers handle other barriers to learning.
Sometimes we get students who are just in need of clothing or food or anything like that, and so we help.
Full-time therapists target mental health obstacles.
They're learning how to deal with our trauma, right? We used to, what's going on in this house stays in this house. Well, that trauma continues to flow if you don't get the help you need.
For more intensive care, the district partners with Beachbrook Behavioral Health Center. The team at school makes itself known to students, and they're needed now more than ever.
Just national, we've seen that the social emotional needs flew up. The depression numbers flew up. The suicidal attempt numbers flew up, right? And so this is very much needed.
Students learn how to manage emotions, articulate feelings and needs. It's also helping to remove the stigma of mental health in a community that rarely seeks the service.
Building those relationships to let them know that they are safe here and that it's someone else that cares about you.
Bedford hopes to ultimately have 100 student ambassadors as it expands its care team. And like other districts, such as Parma and Norton, it's using a national model, figuring out how mental health fits into school. In the newsroom, Monica Robbins, 3 News.